Hi, I'm Dave Chaney, Vice President with the Tennessee Medical Association, here with my colleague Yarnell Beatty, Senior Vice President and General Counsel for TMA. Yarnell oversees our advocacy division, and Yarnell, we want to talk today about government affairs and specifically scope of practice in the 2020 legislative session. We knew that scope was going to be our number one issue coming in. It's now February 12th. Bill filing deadline was last week. We know what we're dealing with here. Specifically with nurse independent practice, which has been a perennial issue pretty much for the last several years. What's happening with that? Where do we stand?
Yeah, the moratorium has passed. It passed at the end of the 2019 General Assembly. Promptly this year in 2020, the nurses have filed a bill sponsored in the Senate by John Lundberg. It's Senate Bill 2110. And House Bill 2203 by Representative Bob Ramsey.
And what does that bill do? What are they trying to achieve?
Virtually unfettered independent practice. It would take away the current collaborative relationship that nurses and physicians have.
So we knew that was coming, or we had an idea that was coming, but that's certainly not the only scope issue that we're dealing with this year. Can you quickly list the others?
Yeah, not by a long shot. There are a lot of scope bills filed this year. The advanced practice physician assistants, we all know them as doctors of medical science. We're expecting them to bring an expansive bill. The physical therapists, there's one, maybe two bills that would expand direct access to physical therapists. The acupuncturists have a bill ready to go. We're expecting that the optometrists will file a bill to allow them to do laser procedure surgeries. Nurses and PAs have a lot of bills. Really, there's one that would allow them to perform certain activities in the workers' comp realm. There are two bills that would expand the prescribing privilege of buprenorphine, one in a more kind of boxed-in setting, one just unfettered. And they're bringing a bill that would allow PAs and nurse practitioners to be second signatories on patient commitment papers. So a lot going on. There may even be more. A lot of caption bills have been filed that can be amended to change scope, and we're watching all of them.
So there is a lot going on. TMA is the largest and most influential advocacy organization for doctors in Tennessee, but that's a lot to take on for TMA.
It's a heavy lift, no question about that. Fortunately, TMA is part of a coalition of about a dozen medical specialty societies who've joined in to battle scope issues in 2020.
So that TMA and that coalition working together, from those discussions, have been heavily focused on protecting patients, opposing bills that are detrimental to patient care, and promoting measures that would increase or enhance patient care and patient safety. What exactly will we be doing in the coming weeks to advance that agenda?
Yeah, no question. Well, we want to preserve the collaboration relationship between physicians and mid-levels. So we would positively bring a bill that would do that. But we also want to modernize that relationship. The current rules were written in the early 1990s. They're antiquated, need to be updated. That hasn't been able to happen. So we're looking to try to accomplish that as well.
Some of the other bills you mentioned, taking a closer look at, you talk about workers' comp. How does that relate to scope, and what would mid-levels actually be doing differently under that bill?
Yeah, well, currently a mid-level can treat an injured worker, but that is from delegation from the collaborating physician. What the bill would do, it would change three things. Number one, a PA or nurse practitioner would be allowed to be on a panel of three employer-designated providers, so that the injured worker would choose between one of the three on the list to be treated. Currently, nurse practitioners and PAs can't be on the list. It's just physicians and chiropractors, so they would be added as well. The second way that it would change things is that they would be able to assign impairment ratings to injured workers, which is a very complex problem. It takes a lot of additional training. And then the third thing, they would be expert in determining the causation of the injury. So 3 things that are not happening now would be able to occur if that bill passed.
So while they can treat currently patients under workers' comp scenarios, this would expand those scope of their scope far beyond just that patient treatment.
Yes, it would. They would still, the bill would still call for them to be under collaboration, unless that changed. But this would allow them to be front and center on those lists and be able to give the expert opinions.
So we have a lot of physicians probably who might be intrigued by the acupuncture bill. What do the acupuncturists want?
Yeah, actually, that could be a success story. The acupuncturists approached our team in November, had a draft of a bill, and we were actually able to review it, make some suggestions, get some language out there that would have been uncomfortably expansive. If they file that bill, I think we're good to go. I don't think there's anything in there that would harm medicine.
Excellent. And then the ophthalmology and optometry, laser surgery issue, obviously nurse independent practice, and we're talking about expanding, physician assistants wanting expanding practice without physician collaboration. That affects virtually everybody across all specialties. But the optometry laser bill is very specialty focused. Why might another specialty want to get involved in something like that?
Well, on a recent coalition call with the dozen or so specialties, every representative on that call believed that optometrists doing laser surgery would be detrimental to patients. It would be dangerous, and so everyone believes that if a procedure is dangerous for one profession or one specialty, if one specialty is impacted, then it really impacts all of medicine, because medicine needs to speak with one voice. So I think the coalition was united in opposing that. And quite frankly, it may be ophthalmology this time, but it could be psychiatry next time, another specialty. And I would think that they would want everyone in medicine uniting behind them to protect patient safety as well.
Well, we know how advocacy work gets done, and the most effective way is for physicians to get involved and to speak up. There are a lot of issues here, some of which may be more or bigger issues to certain specialties, or some physicians may care more about one or the other. But in general, if doctors want to get involved, and we do very much want and need doctors to get involved, how can and should they go about that?
Well, there are a lot of ways. First of all, in order to follow us and follow the progression of some of these bills, we have a weekly political pulse, an e-newsletter that goes out on Friday afternoons during the session. It gives update on bills, not just scope bills, but a lot of bills of interest to physicians, so they could follow that. Responding to calls to action, coming on March the 25th to our annual Day on the Hill, and actually lobbying their legislators in opposition to some of these bills. And certainly, making contributions to impact, which is TMA's Political Action Committee. That's where we support legislators who are supportive of medical issues. And that money can be used to make sure that they're reelected, that our friends of medicine are elected, and that those who oppose us, we could support their opponent and get them out. So a big PAC sends a message to legislators.
And I would add to that as well, thank you, all those great suggestions. Following TMA on social media for the latest updates, at TNMed on Twitter, at TNMed on the Hill as well, where we have real-time information as things move very quickly on Capitol Hill, and you can get information about those bills. And then in terms of our grassroots network, we do want and encourage all physicians to contact your elected officials, let them know where you stand on these issues and other healthcare issues and bills that are important to you. And TMA can help you facilitate that through our grassroots network. Information is there up on the screen, or you can look at tinmed.org/grassroots to get connected today. Thanks, Yarnell. We'll have more information as
Busy
this develops.
session.
Thank you.